What if I told you that some medical tests could be stealing years from your life instead of adding them? I'm about to reveal for screenings that might be doing more damage than you ever imagined, especially if you're over 60. Welcome to my YouTube channel. I'm Dr. Robert. Today, we're diving into a topic that most physicians won't discuss openly. After practicing medicine for over 20 years, I've witnessed a disturbing pattern. Patients who follow every screening recommendation often end up worse than those who take a more selective approach. This isn't about avoiding healthcare, it's about understanding what truly protects your well-being and what might actually compromise it. Let me introduce you to a concept that transformed how I advise my patients: the medical cascade. Picture this scenario: you're feeling excellent, enjoying life, staying active. Then you undergo a screening test. The results reveal something. Perhaps it's an unusual shadow or an unexpected marker. Here's where things spiral. That discovery triggers another test, which leads to a specialist referral, then a biopsy, possibly surgery. Each step carries genuine risks, complications, infections, psychological distress. The shocking conclusion? In most cases, that initial finding was completely harmless and would never have affected your health. Test number 1. Full-body imaging scans. These comprehensive CT or MRI scans promise complete peace of mind by examining everything simultaneously. The marketing sounds incredible: detect problems before symptoms appear, but reality tells a different story. Consider this: you're 67, feeling fantastic, physically active. You decide to get scanned just to be safe. Days later, the report mentions a tiny lung nodule, a kidney cyst, or a liver spot. Suddenly, your peace of mind vanishes. You're scheduling follow-ups, seeing specialists, possibly undergoing biopsies, each carrying real risks. Here's the startling truth. Research shows that scanning healthy individuals over 60 reveals abnormalities in approximately 90–95% of cases. These incidental findings are typically harmless, essentially internal aging markers, like wrinkles you can't see. Yet once documented, they demand attention. Studies tracking these patients reveal something profound. Those who received full-body scans didn't live longer or avoid diseases compared to those who didn't. However, they experienced significantly higher anxiety, depression, and underwent far more unnecessary procedures. What to do instead? Focus on functional health. Can you climb 2 flights of stairs comfortably? Rise from a chair without assistance? How's your balance and sleep quality? These practical indicators reveal far more about your actual health than any scan. Partner with a physician who'll review your medications thoroughly, discuss nutrition, physical activity, and social connections, the genuine determinants of health. Test number 2, brain MRI for minor memory lapses. Perhaps you're in your mid-70s and occasionally forget an actor's name or why you entered a room. Completely normal age-related changes, but concerned family members push for a brain scan to rule out Alzheimer's. Here's the problem. When you receive that MRI report, it contains alarming phrases: cerebral atrophy, white matter lesions, small vessel disease. These sound catastrophic. The reality: they describe what virtually every brain looks like at that age. It's comparable to scanning skin and being shocked to find wrinkles. Research demonstrates that over 90% of healthy people above 75 show findings that appear abnormal on brain imaging. Yet most have perfectly normal cognitive function. The images don't correlate with reality. I've treated sharp, active individuals whose MRIs look concerning, and early dementia patients whose scans appear normal. Better approach: use simple office-based cognitive tests that actually measure brain function: remembering words, drawing clocks, counting backwards. If these reveal concerns, investigate reversible causes: medications, vitamin B12 deficiency, depression, sleep apnea, thyroid issues. Correcting these often restores memory completely. No MRI required. Test number 3. Routine cardiac stress tests. Imagine you're 72, scheduled for minor surgery like hernia repair. Hospital protocol requires everyone over 72 complete a cardiac stress test beforehand. But if you regularly walk 2 miles without chest pain or breathlessness, what additional information will a treadmill provide? Your daily activities already demonstrate your heart's capability. The problem: stress tests produce high false positive rates in older adults. The test suggests problems that don't exist, perhaps due to medication effects or normal age-related changes. This triggers cardiac catheterization, an invasive procedure threading tubes through arteries to your heart. Often, doctors find exactly what's expected in a 72-year-old heart: some plaque, minor narrowing, nothing requiring intervention. But you've undergone an invasive procedure, been labeled a heart patient, loaded with new medications, and lost confidence in your physical capabilities. Smart alternative: listen to your body. Your best stress test. If you manage stairs, walk briskly, and perform normal activities without chest discomfort or unusual breathlessness, your heart is functioning adequately. For future risk assessment, consider a coronary calcium score, a 5-minute CT scan measuring arterial calcium buildup. This provides risk information guiding prevention choices without automatically triggering invasive procedures. Test number 4: colonoscopies after age 75. Let me be clear, colonoscopies are excellent tools. I recommend them starting at 45-50. They prevent colon cancer by removing precancerous polyps. But every medical test involves balancing benefits against risks, and this balance shifts with age. Colonoscopy benefits involve preventing cancers that take 5 to 10 years to develop into problems. But at 78 or 80, are those benefits worth the increased risks? Preparation can dehydrate older adults. Sedation carries higher risks of confusion or breathing issues. Most concerning, perforation risk: colon wall tears roughly doubles or triples after 75. As colon walls thin with age, accidental tears during the procedure become more likely. Perforation means emergency surgery, potentially a colostomy bag, possibly ending independent living. If life expectancy is under 10 years, you're statistically more likely to be harmed by the colonoscopy than saved by it. That's why guidelines recommend stopping routine screening between 75-85 for average risk individuals. Better strategy: shift to smart surveillance. Pay attention to symptoms: persistent bowel changes, blood in stool, unexplained pain or weight loss, anemia. These warrant immediate evaluation regardless of age. Meanwhile, emphasize dietary fiber: fruits, vegetables, beans, whole grains. This provides colon protection benefiting your entire body with zero risk. Notice the pattern? These 4 tests: full body scans, brain MRIs for normal forgetfulness, routine stress tests, and late-age colonoscopies, all risk-triggering cascades where one test leads to another, 2 procedures, 2 complications. Somewhere along this path we forget the crucial question: is this person actually better off? Here's my key message: health isn't about perfect test results. It's about function, doing what you enjoy, spending time with loved ones, maintaining independence and dignity. Sometimes protecting that means declining tests that send you down unnecessary rabbit holes. I'm not suggesting you avoid all medical care. I'm advocating for being an informed, empowered patient. When tests are recommended, ask why. Ask what happens if something's found. Ask about risks and alternatives. Then decide based on what matters to you. You're in charge of your health, not protocols, not computer reminders, not guidelines. If this information opened your eyes to a different perspective on medical testing, I've got more content that'll help you navigate healthcare decisions wisely. Click the video appearing on your screen right now. It reveals 5 common medications doctors prescribe too often after 65, and what you can do instead. And if you want more honest, straight-talking health conversations like this one, hit that subscribe button and turn on notifications so you never miss an upload. Your health is too important to leave to autopilot. I'll see you in the next video. Stay informed, stay healthy, and remember, sometimes the smartest healthcare decision is knowing when to say no.